Hi, this is your health, mind, and body video. Well, channel. Sorry. Now, can I end that? Anyway, I want to tell you something that some people might just be going through. It's called a hip surgery. I've had a hip surgery myself. Okay. I had it when back in, was that 2006, I believe. No, I had mine in 2007. Yeah. I had it in 2007. I was in my 40s then. Okay. Anyway, I want to share with you 5 tips to get you through this process. Okay. Tip number 1, don't worry. Do not worry. It is a process that some of us go through. I had a fractured hip. I didn't even know I even had a fractured hip. I just know it hurted. You know, every time I walked, it hurt and everything. I had a very, very great hospital. I had a very great doctor. My doctor was over at Mercy San Juan and everything. He was a great doctor. I don't want to give out his name or anything like that because I don't know if he wants that to happen. But I want to say one thing is don't worry. Do not worry about it. Talk to your number 2. Talk to your doctor. Get all the information that you can get about this hip surgery. Okay. It's going to be a couple of hours. Okay. You're going to be in the hospital for at least 2 to 3 days. Since I was younger, they was trying to get rid of me real quick. Okay. You know, it was like 2 days. And I was like, can you go and believe me, after you have your surgery, I say at least good 24 hours, they're going to want you to get up and start walking. They're going to want you to start walking down the hallway, back up the hallway. You got your little walker thing. You know, you got your little walker thing and everything. And they want you to walk this way and this way for about 5 to 10 minutes. They're going to want you to do that. Believe me, you have to do this. You have a new joint inside your hip. They are going to want you to do that. Let me fix this camera. They are going to want you to do that. The picture behind me, that's Mother Guadalupe. She looks over children. So I'll show that definitely. They want you to get up. You have to start walking. I don't know how many times I can say this. You have to start walking. If you don't, it is going to work, but it ain't going to work the way you want it to work. So please get up, even though you don't want to. It may be a little bit discomfort. You're going to have some discomfort, but they want you to get up and start walking. You have to get up, take baby steps, just like how you did when you was a baby. You have to do the same thing all over again. Like I said, there's going to be some discomfort. Okay? So don't worry about it. Please don't worry about it. You can get through this. Okay? I'm talking to all the older people now. Okay? With all that we didn't turn around and been through, of course, you can get through this. I know you can. Okay? Tip number 3. Like I said earlier, the time in the hospital. You're going to be there. In some cases, it might be a little longer. You know, mine was 3 days. Okay. All right. For different people, it might be a little bit different. Okay. You know, but anytime you will spend anywhere between 2 to 4 days in the hospital. You will. Okay. And also, too, I want to turn around and tell you this is not a tip. This is the truth. Okay. When you get a little bit of discomfort, that medication button that's over there on the side of you, hit that. Don't sit up here and say, I've been in the Marines, I've been in the Army, or I can get through anything. Boo-boo. No, boo-boo. Hit the medication button. It's there for a reason. Okay? All right? Hit the medication button. It's there for a reason. Okay? You know, just like Sinbad turned around and said, shout out to Sinbad, just like Sinbad turned around and said when he had his knee replacement and everything, and they turned around and they said, when he started pushing the medication button, they said, oh, here you go. There go Mr. Clinky. It's the truth. You're going to feel some discomfort now. You are going to feel some discomfort. Hit the medication button. Now, we ain't talking about you hitting it and everything, but you're going to feel a little discomfort. It's the truth. You are going to feel some discomfort, okay? The recovery. Let's talk about that, okay? Before you even go in the operating room, you out, okay? My doctor turned around and asked me when I was there and everything. He asked me, he said, well, we didn't went over everything because they wanted me there like at 6 a.m. I'm like, who even? I'm a graveyard person, okay? I work graveyard for over 20 years, okay? Who? 6 a.m? Really? 5:30? You want me there at 5:30 just because of preparation and everything? They want you there early, for real, okay? So be there on time because they waiting on you. They are waiting on you to get there. So, but my doctor, he's turned around, he told me, he said, and I'll never forget it either. He said, well, we've already been over preparation and everything. Is there anything that you want to say to me before we go back here? And I said, no, but I want to talk to the anesthesiologist. And this is exactly what I said. I said, you can put me to sleep, right? He said, yeah. I said, can you wake me back up? He said, yes, I can. I said, that's all I'm worried about. If you can put me to sleep, wake me back up. This is not Michael Jackson. Shout out to Michael. Sorry what happened to Michael, but this is not Michael Jackson. If you can put me to sleep, wake me back up. And I mean that, okay? Just had a newborn, got a fiance sitting over there. No. Wake me back up. Before you go back there, you already out. Don't even worry about it, okay? So now while you over there in the recovery room, it's going to take a little few minutes for you to, you know, get undrowsy and everything such as that, you know, for some apparent reason, I don't know why, my mouth was dry. I don't know about anybody else, but your mouth might be just a little bit dry and stuff like that. So don't even worry about that, okay? You know, they going to take care of you on that part right there. Tip number 5. I have to say this. This might be very long, but I got to tell you. After the surgery, after the recovery room, after you being in the hospital, and now you get back home, if they want to turn around and tell you about, taking medicine and everything, and, you know, because of blood clots or whatever, because you don't want no blood clots. That's the show. You definitely don't want no blood clots, all right? So, especially being diabetic, you definitely don't want no blood clots, okay? Recovery. Go to the recovery place that they tell you to go to. I don't know how many people that I have talked to say, oh, man, I'm not going to no recovery. Even a couple of ladies turn around and say, I'll be okay. And it all depends on what type of hospital that you are at. They might have a swimming pool for you. And believe you me, I was in there. Me and the older ladies was in the pool, walking around, having a ball too. The only thing we needed was some martinis. That's some martinis, some cheese and crackers. That's all we needed because we was good. Go to your recovery appointments. I can't stress this enough. Please go to your recovery appointments. Go. You have to go. If you don't go, you're going to be walking around the house and slip. Bam, there you go, back in the hospital again. You don't want that. So let's go over everything once again. Like I said, don't worry. You're going to have a hip replacement, a total hip replacement. I had a total hip replacement in my 40s. Yes, total hip replacement. No problem. I turned around and told my mama, I said, Mama, I'm about to have a total hip replacement. She said, I know, baby. It's okay. You gonna be okay. I said, I'm about to be the bionic man in a minute. Okay. So number one, don't worry. Talk to your doctor. If you are older or anything like that, and the kids is with you and family members, ask the doctor questions. Ask them. My doctor turned around and he told me, he asked me, do you want a Cadillac hip replacement or do you want a Ferrari hip replacement? I said, what's the difference? He said, with a Cadillac, you're going to be back in here in about 3 years. With a Ferrari, we're not going to see you. I said, okay, let me get the Ferrari. Okay? Like I said, don't worry. Number one. Number two, talk to your doctor. Number three, time in the hospital. You're going to be there for a minute. So relax. Okay? What I turned around and I did at my hospital, now, it may not, this is a disclaimer, okay? You may not want to do this, but when I was in the hospital, I think it was the second day that I was in the hospital, I called down to the kitchen. I sure did. I called down to the kitchen at 4:30 that morning and told them exactly what I wanted. Yes, I sure did. I called them myself and said, hey, this is what I want. Bring me, because the first day I didn't want that. No. No. I wish they had a Los Palmas burrito shop right around the corner because I could get one of them every day. So the second day I called them, I had to call them. I called right to the kitchen. I said, I'm in room such and such. Can y'all bring me this, and this? It was like, let me see. Well, your doctor doesn't say anything about you being on a diet or a diabetic diet or anything. Yeah, you can have whatever you want. Thank you. Okay, so I just wanted to say that. But anyway, number 4, recovery. It's gonna take a minute to do this. Okay, you got a new hip. You got to be able to work, move that hip up and down. You got to be able to get it in the groove and everything. You got to be able to move it. Okay, recovery time is gonna take a minute, anywhere between 3 to 6 months, depending on you. Okay, because everybody's different. All right, and number 5. I can't stress this enough. Please go to your recovery classes, your appointments, whatever. Go to your recovery appointments, please. And this is health, mind, and body. And I'm out. Y'all have a good day.